So first, what led to you wanting to prosecute people who don't complete deflection?
Well, when we start from the beginning, the Oregon State Legislature recriminalized drugs, and they provided a lot of off-ramps, and that was deflection. And certainly I want to see that program work, and my whole philosophy has been compassionate accountability. But right now, when we've looked back, we've had a year, and we just haven't seen any results. The accountability piece is missing, and it's just about taking the program that we have, building it up, adding in accountability in a way that hopefully really supports people getting into treatment and engaging with treatment.
So what will that process look like exactly?
Yeah. So, a lot of it's not going to change. An officer will make an arrest, they'll take a person to the deflection center, they'll drop them off. At that point, that person has a lot of resources that are going to be available. They can go and get assessments done at the deflection center, and then from there get some referrals out to various treatment options. What is changing is that they can't simply touch the door and walk away. That has to end. The other part is that once those assessments are done and they've got those referrals, all I'm asking is that they actually take some meaningful steps to engage in some treatment.
How will you know if they don't?
Well, after 90 days, we'll certainly go to the health department and we'll ask them. We'll say, has this person engaged in any meaningful treatment? We'll get a report back from them and we can make an assessment from there. As we start out, of course, we're going to be flexible and try to work with people and do all we can to really help people who are maybe struggling to get through treatment as much as they can.
So in a memo from your office, officers are instructed to submit all investigative reports when someone is taken to deflection, and prosecutors may file charges if that person fails to engage. What does meaningful engagement here actually mean?
Well, we left that broad because we certainly wanted input from treatment providers, from county commissioners and others. But for me, what it really comes down to is the person actually taking some steps. Did they go to some meetings? Did they enroll in a detox center? There are lots of options. And I'm someone that believes there's a lot of different pathways to sobriety and to getting healthy. And so I'm not trying to be overly prescriptive and say it has to be this one way or the other. It's about allowing for many pathways to treatment.
You've also said you plan to expand the number of drug possession cases that are eligible for deflection to include things like disorderly conduct or criminal trespassing. What outcomes are you hoping to see from that?
Well, I want to see individuals actually start to benefit from a program and see that the deflection is actually working in the way that I think the community really expects. So in a way where people are now being connected to treatment. If that's occurring, then yeah, I want to see it expand.